The district is similar to the health alert notice that we sent out back in December when we were seeing pneumonias of atypical etiology before SARS-CoV-2 or COVID-19 even had a name. So it's part of our way of trying to capture enough data to make sure none of these cases are going missed in the district as it relates to this pediatric syndrome. Currently, a lot of the pediatric hospital providers across the nation are working with the CDC to make sure that we have the best description of this pediatric syndrome, and as that information comes out, we'll make sure that we update our health alert notice. At this time, we do not anticipate that the number of children to be impacted with this atypical presentation will compromise our medical surge efforts. There has been one case in a district resident.
More children that aren't district residents. So are you only getting information from your children on those that are district residents and not patients that?
So to continue to clarify, hospitals are only required to report to us, and healthcare providers are only required to report to us cases that occur in district residents. However, we have visibility on all admissions in hospitals in the district, regardless of residency. So when we're talking about a hospital's capacity to admit patients who have any diagnosis, you've seen that information today. When we talk about 71% of our hospital's capacity, whether it's COVID-related or non-COVID related, that's for people regardless of where they live. If they're a DC resident, Maryland resident, California resident, receiving care in our system. So that what gives me the ability to say that we have the capacity in our system, including in our children's hospital, to be able to take care of individuals whether they have COVID or non-COVID diagnoses. As it relates to any children who are receiving care at Children's with this particular diagnosis, they are only required to report cases to us that occur in district residents.
Appreciate you going through that. So the number on the chart of COVID patients that are being reported by hospitals, is that also all COVID patients, like the total patients is, or is that just DC residents?
That chart is all patients regardless of residency.
Thank you.
Yes, sir.
To chart 5.
Yeah.
Okay. Page 5. Okay. Thank you, everybody. Thank you.
DC, the District of Champions. Still, life as we know it can change in an instant. But we are champions. Champions get the work done. Champions stay home and educate our children and protect our most vulnerable. Champions practice social distancing and support our local businesses. Champions continue to keep us safe. DC, still the District of Champions.
This yellow line makes some Americans less equal. This is David. He has lived in D.C. all of his life and has 2 kids. This is his neighbor, Bernardo. He and his family live in Maryland. Bernardo and David are both U.S. citizens. Bernardo has a voice in Congress. David does not. Congress can even overturn David's local laws, end taxation without representation. Join D.C. Vote today.
Mayor Bowser wants DC small businesses to know that the Federal Small Business Administration has accepted DC's declaration for economic injury relief related to the coronavirus.
While we continue responding and mitigating the spread of the coronavirus, Mayor Bowser is launching our economic recovery effort. One step in our economic recovery effort is relief options for small businesses offered by the federal SBA, which will provide targeted, low-interest loans to local businesses that have been severely impacted by the coronavirus.
This federal program provides working capital loans of up to $2 million to help businesses overcome the temporary loss of revenue. We encourage businesses to directly submit their federal SBA application at disasterloan.sba.gov.
For more information about the district's coronavirus response and recovery efforts, visit coronavirus.dc.gov. As Mayor Bowser says, we're all in this together, and we'll all get through this together.
Good morning. If everyone can get ready. Thank you. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and we are here today in the Walter E. Washington Convention Center. I will provide an update on the district's response to COVID-19. I am going to provide some general updates, share more information about our medical surge planning, and we will also hear from our partners who have been involved in building this incredible facility. I am joined by members of my cabinet. To my right, Chris Rodriguez, who is the Director of D.C. Homeland Security, Dr. LaQuandra Nesbitt, who is the district's doctor and our Director of the Department of Health, Christopher Geldhart, who is leading the operations section of our Emergency Operations Center, and Jennifer Smith, who is the Director of the district's Department of Forensic Sciences. I'm also very delighted to be joined by our federal partners who have worked hand in hand with us, certainly for the last 22 days of construction, and longer than that in planning for the district's medical surge. We will hear from Pete Gaynor, who is the administrator for FEMA, the Federal Emergency Management Agency, as well as Lieutenant General Todd Simonite, who is the chief of the Army Corps of Engineers. He's the chief of engineers and commanding general, as well as Dr. Jack Sava, who is the chair of MedStar Washington Hospital Center, Brigadier General Aaron Dean, who is the adjutant general of the D.C. National Guard, as well as Greg Odell, who is the president and CEO of Events D.C. Let me start by first reporting that we have 117 new cases of COVID-19 reported yesterday, bringing our total to 6,389. And sadly, we announced that 5 Washingtonians have succumbed to the virus, bringing the total of lives lost in Washington, D.C. to 328. Here you also see the number of new cases reported over the last week, as well as the average of new cases per day over the last 2 weeks. I have also want to provide a brief update on where the district is with antibody testing. Until now, most of the testing that has been happening has been diagnostic to determine whether a person has COVID-19. Now, DC Health and the Department of Forensic Sciences are working with healthcare providers in the district to conduct a citywide survey to test for antibodies. While healthcare providers are receiving guidance on who should be considered eligible for antibody testing, the survey will focus on individuals with a high risk of exposure. The experts still don't know whether previous infection causes any sort of immunity, but this testing will be important to helping us determine the extent of infection in our city, the prevalence of asymptomatic infections, and insights on how the virus is affecting children. Now I want to move on to the part of today's update that addresses why we are here in the Washington Convention Center. In early April, we shared with you how we were planning for a medical surge, and that was only a month ago, and a lot has happened since then. We are pleased in the district that our numbers, the numbers of positive COVID cases in the district, are far lower than what we predicted they could have been on this day. But we have yet to see a 14-day decline in community transmission. And so we continue to have a lot of work to do to stop the spread of the virus in our city. In terms of planning for a medical surge, we also know that without a cure and without a vaccine, that phased openings will mean that we see more cases in our city and our region. So part of our surge planning takes that into account and readies us for a potential second phase. Here you can see a chart and that going forward we will provide regularly. It will be posted on a daily basis at coronavirus.dc.gov. This chart shows how many patients are in our hospitals, how many patients are hospitalized for COVID-19, and how close our hospitals are to reaching their capacity, both their normal capacity and using surge beds. You can see that yesterday, 1,775 patients were hospitalized in DC, which represents 71% of the district's standard operating capacity at our acute care facilities. Normally, without a pandemic, our acute care hospitals operate around 75% of capacity. The average utilization since April 1 has been under 70%, indicating that there is sufficient bed capacity within our facilities. So again, DC residents should not hesitate to seek medical care for COVID and for non-COVID related concerns. To support any potential medical surge, we have, of course, been working with hospitals across the city to identify capacity for an additional 1,600 beds within our hospitals. This chart shows where those surge beds are located. I want to, of course, thank all of our hospital partners for working hand in hand with us to make sure that the most acute patients are seen within the four walls of our hospitals that are waiting to give them excellent care. We are grateful to all of them, and you can see them listed here at MedStar Georgetown, MedStar Washington, who we'll hear from today, MedStar National Rehab, the George Washington University Hospital, Howard University Hospital, Children's National, Sibley Memorial, United Medical Center, and Bridgepoint at Capitol Hill and National Harbor. And just as you can see that we will report to you, we are monitoring our hospital capacity very carefully, which will let us know if and when we need to use the excess capacity that you will see here today. I've said before that we consider this site our insurance policy. We hope that we will never have to use it, but it is here and staffed for when we do, or if we do. This hall, Hall A, is set up to accommodate 437 beds, and starting tomorrow, it would be ready in terms of equipment and staff to care for up to 100 patients. The patients who will be coming here will be low acuity COVID positive patients, meaning these are patients who need neither a ventilator or an ICU bed. However,
and now, we bring you the following live press announcement from DC Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning, everyone. I'm Uriel Bowser. I'm the mayor of Washington, D.C. I'm here to provide an update on the district's response to COVID-19. I will share some general updates. I'm joined by members of my administration who are also available to answer questions. This morning, the district reported 99 new cases of COVID-19, bringing our total positive cases in Washington, D.C. to just over 6,500. And sadly, today, we report that 350 Washingtonians have lost their lives to this virus. So I know that many people, certainly us, watch these numbers daily. So I want us to spend a few minutes going over what it is that we are looking at and what we are monitoring as we think about our plan for phased reopening in the district. I also want us all to remember that each of these cases are people, our neighbors, families that have been tragically affected by this virus. And so our thoughts are always with those people who have been fighting it and people who we have lost. You will note on this slide our daily numbers as well as our experience over the last week. And in terms of our phased reopening plans, we will spend some time, and Dr. Nesbitt will weigh in on all of these factors that the district is watching, including how the virus is spreading through our community, our testing capacity, the capacity of our healthcare system, and the capacity of our public health system to trace contacts for every new infection. And these factors are, of course, based on guidance from the federal government, from academic institutions, including the Johns Hopkins University, as well as our local knowledge and analysis of how the virus is impacting our community. We went over some of this last week, but here again is how we are monitoring the spread of COVID in our city by watching trends in new cases, as well as looking at the rate of transmission, which basically tells us how many new infections come from each case of COVID-19. So again, we are watching for a 14-day increase in the amount of community spread. Today, we are at 4 days of a decrease. We're also watching the transmission rate and looking for it to be under 1 for a sustained period for 3 days. Today, we are at 2 days. In terms of community spread, Dr. Nesbitt will talk more about this, but that data point is based on more than just the number of new cases. It also depends on the symptom onset date, as well as where those cases are. For example, if they're in a congregate setting or not. So as of right now, we have a 4-day decrease in community spread. And as I mentioned, our rate of transmission has been below 1 for the second day. In terms of testing capacity, you can see right now that we are able to test in each of the 4 areas that are important to a phased reopening. We can test all symptomatic people. We can test all at-risk healthcare workers, all essential workers, and close contacts of all new positives, and we have that ability now. We still, however, don't think we're testing all of the people who need to be tested in those 4 groups. And so we continue to reach out to people, making everybody aware of the testing locations and that those tests are free. And we will continue to do that. It is also important to a phased reopening that the healthcare system can deal with new cases, can deal with increases in infection, which we know can be the result of reopenings. And so we were this past week, actually on Monday, we were at the convention center, which is part of our surge capacity. And we are also very confident in the number of new beds that have been constructed at area hospitals that are part of our surge capacity. So what we know now is that the hospitals have been operating without use of that surge capacity for over 14 days, which is very important. And finally, a huge part of our ability for a successful phase reopening is our ability to trace every new infection and the contacts of any new infection. And this is the piece that will help us ensure that we won't have widespread community transmission when we see those new infections, but we're able to keep it under control. Earlier this week, I directed $2.3 million for hiring additional contact tracers. On Monday, the Human Resources Office for DC Government and DC Health onboarded 17 new contact tracers with at least 200 more tracers and managers to come. So you can see on this slide what our goals are with contact tracing, that we will be able to contact any new case within 1 day and their close contacts within 2 days. And so currently where we are is that we can contact trace for our priority populations and their close contacts. So building out our ability to contact trace is ongoing. The purpose of tracking all of these metrics, of course, is to ensure we are transitioning from community spread to more isolated clusters of the virus as we begin a phased reopening. And obviously, we're not there yet and not quite ready to begin that phase new opening. So today, we will extend the district stay-at-home order through Monday, June the 8th. And I should note that based on the data, I can revise this order at any time to reflect a phased reopening if the data suggests that we can do that. So we will extend from May 15th to June 8th until such time that the data say that we can begin a phased reopening. And I think everybody is aware of the Reopen DC Advisory Group and that they are working diligently to make recommendations to me on how 11 sectors in the district's economy are able to open with guidelines and recommendations. And I expect to hear from Reopen DC next week on those recommendations. And to support those efforts, I want to today announce a new pilot program. It is the Educational and Academic Retail Shops Pilot. And through this pilot, we will grant waivers to locally owned stores in the city that sell educational items such as books for curbside and front door pickup. The stores will need to agree to share data and information with us about their operations. We think it's very important for our retailers as well as regulators and DC government during this pilot phase to learn important lessons about reopening while ensuring safe operations and safe interactions with their customers. More information on this pilot will be posted at coronavirus.dc.gov, and businesses will be able to begin applying on Friday. So stay tuned for that. The lessons we know that we learned from this pilot will help all DC businesses understand and plan for challenges with reopening. But I want to be clear that in deciding when to reopen, we will continue to follow the advice of our health officials. We know, and everybody heard Dr. Fauci tell the Senate committee yesterday that rushing to reopen could have tragic results, and we've said this many times before. We are eager to get our economy turned on, get people back to work, get kids back to school, but we know a second outbreak could be even worse. So we want to just focus on some things that we have been telling people throughout, but continue to be very important reminders. Stay home. Continue to stick with essential trips. If you have an essential job, for food, for medicine, and for fresh air and exercise close to home. When you go out, wear a mask. If you feel sick, stay at home. Don't risk your health or anybody that you're in contact with. The symptoms of COVID-19 have grown. The list of things to look out for have grown in the time that we have been responding to this pandemic. So call your doctor or call our testing hotline to get a test. If you have been tested for COVID-19, you must isolate yourself and strictly isolate yourself. If you're able to do it in your home, and if you're not, call us and ask us for assistance. The testing numbers are here, 855-363-0333, in English and Spanish, 844-796-2797. And more than that, an additional number, if you need help isolating, you cannot isolate safely in your home, call us at 888-349-8323. We also have some updates related to food, which is keeping the food supply going and making sure that people can isolate in their homes. Taking care of necessities and essentials like food will help people do that. Several weeks ago, we applied for a waiver from the federal government that would allow SNAP beneficiaries to use their benefits to buy groceries online. And starting today, people will be able to do that through Amazon. So at this time, Amazon is the only retailer approved by the federal government, but we're also assisting local retailers who are interested in participating in the program with submitting their applications for review and approval by the USDA. So please, this is a very good thing. I'm glad that we were approved and to use SNAP benefits on Amazon.com. You can go to their website and /SNAP-EBT. I also want to, before we take your questions, give a big thanks from DC residents to Speaker Nancy Pelosi for questions.
Can you talk more about what this metric of sustained community transmission means? Because I think you mentioned that it's not just the number of new cases every day, but there's more to it.
Yes, Dr. Nesbitt.
Sure. So you'll recall that when we first talked about in a more concrete way our metrics for transitioning into a phased reopening, we made it very clear that we were going to be looking at 3 buckets. related to our surveillance activities around the symptoms that we would be seeing in the community, the numbers of new cases in our hospital capacity. Since that time, a couple of weeks ago, I think it may have been the end of April, we've had the opportunity to consult with our colleagues around the country to be very deliberative around how we are measuring the new cases. We know from a public health perspective that there's a number of ways to measure the new cases. What we report out to you all on a daily basis is the number of new cases that have been reported into us, either by lab reports or by what we call electronic case reports. And so that's just simply an accounting of new information, new inputs into the department. A much better indicator, and I think we've had this discussion before, is when we get those new lab reports or new electronic case reports, we're able to see what the actual symptom onset for those individuals are. So if you really want to appreciate the disease patterns or new infections in a community, you can actually look at the symptom onset for the district. So for us to be able to see a sustained decrease in community spread, we believe that's the best way for us to track if we're seeing that downward trend for 14 days by looking at, one, that downward trend from a symptom onset perspective, which is much better than the accounting of information into the department, and two, community spread, which is for those of us who move around the community and are not in congregate settings where we do not leave that particular setting. So we move out the data from settings where individuals have a low likelihood of spreading disease around the community. So in skilled nursing facilities, the residents of skilled nursing facilities who don't leave those facilities, and some other congregate settings that we've identified. So it's less easy for you to look at the number of new cases reported every day, and easier for us to look at this other metric of cases of community transmission.
So what does that look like for you when you do your morning data reviews? Like, do you have a spreadsheet that shows the different dates and how many people develop symptoms on those dates?
There's a number of things that I look at. There's something called an epi curve that most health departments look at. The CDC also has an epi curve that looks different than the number of cases that are reported on any global tracker that also looks at symptom onset information that is reported to them. Epi curves are how public health professionals track the presence of disease in communities, and it's why as other health agencies across the country, public health agencies, are refining their epi curves, you are now hearing more information about how virus may have been present in communities at earlier times than initial case reports may have indicated.
Yes.
For the pilot program, how many businesses will you approve, and what kind of requirements will businesses need to fulfill to be approved for it?
Well, we will have the application or some waiver specifics posted on the website on Friday. And give me the...
How many businesses will you approve for the pilot program?
We think that there is, and I haven't seen the whole list of, we've asked DCRA for a list. We think there are about 40 businesses in this category or less. So it's less than 40.
Will they have to fulfill like safety requirements for their?
Oh, absolutely. So we will be asking them what their plan is. Now, this is for curbside or front door delivery, but we want to know about their hours of operation, how they communicate with their customers, how they'll communicate with their employees, what plans, and this is not an exhaustive list that I'm rattling off now, but how will they handle sanitation in the business and protective equipment for their employees? And other ways of communicating like signage and those sort of things.
Can I just follow up on the retail?
Yes.
So why did you pick educational and academic retail shops, and why only local shops? I guess, does this mean like a national chain of Barnes and Noble or Borders, they wouldn't be able to qualify for this?
Let me start with the first part of your question. We know that our kids, for example, have been distance learning. They're going to continue to distance learn. And we know a lot of families are continuing to look for ways for new materials and ways to make sure that kids are engaged, enriched, having fun, and learning. And we know that a lot of folks are buying these types of materials online. And we also know that this is a small enough group that a pilot can be very effective. So that's why we've chosen them. And again, on the local shops, we want to make sure we're starting with our local folks and learning from them. Yes.
So Mayor, did you talk to Dr. Anthony Fauci as you were pondering your decision, and did the situation in the Maryland and Virginia suburbs where they're, I guess, extending their stay-at-home orders, did that impact you at all?
Did what? Did the Maryland and Virginia, I'm sorry.
The fact that my understanding is that the suburbs of DC, for the most part, are not going to be opening up as the other parts of Maryland and Virginia are. They're continuing to basically have a stay-at-home situation. And did you talk to Dr. Anthony Fauci?
I have talked to Dr. Fauci, and Dr. Fauci also gave a short briefing to one of the reopen groups. Yes, so yes, I have talked to him, and I think, as I have mentioned a number of times, our decisions around the district are certainly based on the data that we see and the Department of Health's recommendations. But I on how to reach out to their members who are particularly, because of their health history, susceptible to COVID. And so that we're developing that strategy now, and I would guess that there will be a big marketing aspect to that strategy. Julie Zosmer.
Hi, it's Julie Zosmer from the Washington Post.
Hi.
You've talked about the spread of the virus inside people's homes, especially some of the densely populated apartment buildings in Columbia Heights and other neighborhoods. So I wanted to ask, is the health department contacting residents of these buildings to inform them when there's a case in their building, or providing any specialized services like testing or support at any of the specific apartment buildings that are more severely affected?
We are going to be doing a lot of outreach to various neighborhoods and buildings along that corridor to focus on testing and isolation. And that is our focus. And our focus on isolation is not from one apartment to the other, but within an apartment, because that is where we see within a household the transmission within the household being a problem. Okay, a few more. Yes, Mark?
Mayor Bowser, what would you say to small businesses who are getting this news now that another few more weeks of being closed, and they're just really on the brink and freaking out that they're going to lose their businesses? And I mean, they realize there's a pandemic, of course, but they're scared. What do you say to these small business owners?
Well, thank you for that question, because we know a lot of people are scared, and part of the feedback that we've been getting over the last weeks certainly are from business owners who are scared. I am pleased, though, over the last several weeks, I'm hearing about more and more people having gotten PPP relief. We know now that more people have also gotten the micro grant relief from DC government. So all of those things are good. We know more now that more workers have gotten their unemployment payments. That includes the $600 from CARES. So we know that more dollars are flowing through. But I think people, Mark, are also scared for their health, and they want to be sure that when they're able to go back to work, and customers want to be sure that businesses are ready for them. And so I think that is what's so important to emphasize about a phased reopening, that we give all our businesses and customers the insurance that they need to participate again in the economy. Yes?
Tomorrow, there's supposed to be a reopened DC rally in Freedom Plaza, and I was wondering what you would say to those who are organizing that rally and who want to attend it.
I don't know anything about the rally, but it better be small. Yep.
Mayor Bowser, what are you doing to increase pressure on Senate Republicans to include that funding for DC? Like, do you have members of your staff calling up the lobbyists and friends of Senate Republicans to make that case directly to them? Are you rallying DC residents to call Mitch McConnell's office?
We're working on it, Bennett, and that's really all I can say right now. And certainly, we always follow the lead of our Congresswoman. Yes, Scott?
And Mayor, it's Scott McFarland with Channel 4. Has the district considered releasing on a daily basis the number of employees, contract, and DC employees who've tested positive at the homeless shelters? We've spoken to a few who are concerned they don't know how many of their colleagues have been sickened and they don't know the risk.
I think we do report for DHS. I left my other folder.
We do.
We report.
Shelter by shelter.
I'll have to check those data. I'll have to check those data and respond to you. Yep. Any other questions? Okay. Thank you, everybody.
We now return to our previously scheduled program, already in progress.
David's local laws end taxation without representation. Join DC Vote today.
Mayor Bowser wants DC small businesses to know that the Federal Small Business Administration has accepted DC's declaration for economic injury relief related to the coronavirus.
While we continue responding and mitigating the spread of the coronavirus, Mayor Bowser is launching our economic recovery effort. One step in our economic recovery effort is relief options for small businesses offered by the federal SBA, which will provide targeted, low-interest loans to local businesses that have been severely impacted by the coronavirus.
This federal program provides working capital loans of up to $2 million to help businesses overcome the temporary loss of revenue. We encourage businesses to directly submit their federal SBA application at disasterloan.sba.gov.
For more information about the district's coronavirus response and recovery efforts, visit coronavirus.dc.gov. As Mayor Bowser says, we're all in this together, and we'll all get through this together.
DC, the District of Champions. Still, life as we know it can change in an instant. But we are champions. Champions get the work done. Champions stay home and educate our children and protect our most vulnerable. Champions practice social distancing and support our local businesses. Champions continue to keep us safe. DC, still the District of Champions.
This yellow line makes some Americans less equal. This is David. He has lived in D.C. all of his life and has 2 kids. This is his neighbor, Bernardo. He and his family live in Maryland. Bernardo and David are both U.S. citizens. Bernardo has a voice in Congress. David does not. Congress can even overturn David's local laws, end taxation without representation. Join D.C. Vote today. This yellow line makes some Americans less equal. This is David. He has lived in D.C. all of his life and has 2 kids. This is his neighbor, Bernardo. He and his family live in Maryland. Bernardo and David are both U.S. citizens. Bernardo has a voice in Congress. David does not. Congress can even overturn David's local laws, end taxation without representation. Join DC Vote today.
Hi, this is Michelle Obama. On behalf of Mayor Bowser, I wanted to share information on free coronavirus testing for District of Columbia residents experiencing symptoms. If you or a member of your household is experiencing fever, cough, sore throat, difficulty breathing, congestion,